Hello, everybody, and welcome back to Academically, a one-stop solution for cracking pharma competitive examinations. So, in today's lecture, we are going to be discussing about the central nervous system, the diseases, and the pharmacology of the central nervous system. Correct? But firstly, why Academically? So, Academically is a one-stop solution that provides curated data, flash notes, updated mock tests, and also at Academically, the faculties that teach have gone through the process. So they share their experiences, the do's and don'ts. So today we are going to be discussing about the central nervous system. So when I talk about the central nervous system, the diseases that are related to the central nervous system involve Alzheimer's. So we all would have heard about Alzheimer's, correct? A disease associated with amnesia or loss of cognition and memory. The second is the Parkinson's disease, a disease characterized by rigidity, tremor, and bradykinesia. The third is a depression, a disease whereby there is a mood imbalance. The next is the epilepsy, a disease characterized by continuous firing of neurons. Next up, mania and bipolar. Mania and bipolar, sudden excitation or sudden depression. Bipolar, two phases of, in one person, the two moods continuously swing and switch. And finally, psychosis or psychotic, like symptoms. So similarly, there are different neurotransmitters that are involved in these particular diseases. And an imbalance in that neurotransmitter is what that is leading to these particular progressive diseases and neurodegenerative diseases. So in depression, the two major neurotransmitters are noradrenaline and serotonin. In epilepsy, the major transmitters are GABA, glutamate. So there is more excitation and there is less GABA. So which drugs do we give? We give glutamate antagonist, that is NMDA receptor antagonist, and we give GABA agonist, right? So that the excitation and the depression is managed if the levels of the neurotransmitters are balanced. Similarly, in depression, mostly we give selective serotonin reuptake inhibitors, correct? Or selective norepinephrine reuptake inhibitors. In Parkinson, mostly it is dopamine. There is less amount of dopamine in the substantia nigra. Yes, that's a region name. You must know, because these diseases are very region specific also. So when I tell Alzheimer, mostly the hippocampus neurons are being damaged. When I talk about Parkinson's, mostly in Parkinson disease, there is a decrease in the dopamine neurotransmitters. So what drugs we will give? That will be either dopamine facilitator or that will increase the dopamine levels, dopamine agonists. In Alzheimer's, mostly it is the acetylcholine. So which drugs will we give in Alzheimer's? We will give cholinergic drugs. So these cholinergic drugs will help to promote the acetylcholine levels, right? We give donepezil, we give rivastigmine, a lot of different agents that can be given in Alzheimer's disease. And psychotic, mostly the antipsychotic drugs are targeting the dopamine receptors only, correct? So we have chlorpromazine, triflupromazine, haloperidol, risperidone, clozapine, lot of drugs. And in bipolar and mania, mostly we give one agent that is called as lithium. This is a very good mood balancing agent, lithium. But you know, one specific disadvantage you must know with respect to lithium. If there is high lithium in the body, the sodium levels will reduce, hyponatremia. And if there is extreme levels of sodium, then the threshold of the lithium should be increased, because they are exactly opposite. One leads to excretion of the other. है ना? We say, no, एक मियान में दो तलवार नहीं रह सकती. Similarly, so lithium and sodium, they cannot coexist together. So these are some of the very famous diseases you must know. Yes? Do we have any doubts?
Yes, sir. Sir, could you please explain in Hindi a bit all these things in
Yes,
short?
absolutely. Sure, definitely. I will explain
Thank you,
it in
sir.
Hindi as well. या सो जब मैं बात करता हूँ अल्जाइमर्स की, करेक्ट, सो अल्जाइमर्स में होता क्या है, आपके जो कॉलिनर्जिक न्यूरॉन्स हैं वो कंटिन्यूसली डीजेनरेट होते हैं, एंड इन ऑर्डर टू प्रिवेंट दिस न्यूरो डीजेनरेशन हम ऐसे एजेंट्स देते हैं जो कॉलिनर्जिक न्यूरॉन्स को प्रमोट करे, सो दैट या तो एसिटाइलकोलिन का ब्रेकडाउन ना करवाए। देयर कैन बी टू वेज, एक है डायरेक्टली आप कॉलिनर्जिक को प्रमोट करो, या तो आप कॉलिनर्जिक एसिटाइलकोलिन को जो ब्रेक डाउन करा रहा है उसी को इनिबिट कर दो, दैट एंजाइम दैट इज कोलिनेस्टेरेज। सो वी गिव कोलिनेस्टेरेज इनिबिटर ताकि एसिटाइलकोलिन ब्रेक डाउन ना एंड एसिटाइलकोलिन का लेवल मेंटेन। पार्किंसन की अगर मैं बात करूं, सो डोपामाइन, अब डोपामाइन का लेवल्स वी नो दैट इट इज रिड्यूसिंग, तो हम क्या करेंगे, ऐसे एजेंट्स देंगे जो डोपामाइन के लेवल को बढ़ा दे। अगेन इसमें भी दो टाइप है, डायरेक्टली डोपामाइन एगोनिस्ट दे दो, डोपामाइन का लेवल्स प्रमोट हो जाएगा। सेकेंड वे in which we can in which we can increase the dopamine is डोपामाइन को ब्रेक डाउन कराने वाली एंजाइम्स माओ एंड कॉम्टी, मोनोमाइन ऑक्सीडेज एंड कैटेकॉल ऑर्थोमिथाइल ट्रांसफरेज, उनको इनिबिट कर दो तो डोपामाइन का ब्रेक डाउन नहीं होगा, तो ऑटोमेटिकली डोपामाइन का लेवल बढ़ जाएगा। सिमिलरली डिप्रेशन में हम रीअपटेक को इनिबिट कराना चाहते हैं, वी डोंट वांट कि सेरोटोनिन और नॉरएपिनेफ्रिन का रीअपटेक हो, सो इन दिस कंडीशन वी गिव सिलेक्टिव सेरोटोनिन रीअपटेक इनिबिटर्स और सिलेक्टिव नॉरएपिनेफ्रिन रीअपटेक इनिबिटर्स। एपिलेप्सी, एपिलेप्सी में हम पता है कंटिन्यूअस इलेक्ट्रॉन्स फायर होते रहते, सो इन ऑर्डर टू प्रिवेंट दैट हम ग्लूटामेट एंटागोनिस्ट देंगे ताकि जो एक्साइटेशन लेवल्स है वो वापस आ जाए, एंड गाबा की एगेनिस्ट देंगे लाइक बार्बिटुरेट्स, बेंजोडाइजेपिन्स, है ना, ताकि जो लेवल्स ऑफ न्यूरोट्रांसमीटर है, गाबा इज अ इनिबिटरी न्यूरोट्रांसमीटर, राइट, गाबा गेटेड क्लोराइड चैनल्स। एंड साइकोटिक में as I told that बहुत सारे ड्रग्स है, क्लोरप्रोमाजीन, ट्राइफ्लूप्रोमाजीन, जो मोस्टली डोपामाइन रिसेप्टर्स को ही टारगेट करते हैं। एंड बाइपोलर की लास्टली मैं बात करूं, सो लिथियम एंड सोडियम, ये दोनों ऐसे हैं, ऐसे दो आयॉन्स है दैट कैन नॉट को एग्जिस्ट टुगेदर, साथ में रह ही नहीं सकते। अगर ज्यादा लिथियम है तो सोडियम का कम लेवल हो जाएगा, अगर ज्यादा सोडियम है तो लिथियम का जो डोज है वो हमें बढ़ाना पड़ेगा, लिथियम कार्बोनेट, दैट इज अ मेजर मार्केटेड प्रेपरेशन। तो ये पूरा आपका सीएनएस में आ जाते हैं ये सारी डिजीजेस, इंक्लूडिंग अल्जाइमर, पार्किंसन, डिप्रेशन, एपिलेप्सी, मेनिया एंड साइकोटिक। अब in the lecture we are going to study them in detail. Yes, so is your doubt clear? Do we have any doubts besides that? Any other doubt? I hope all clear. Chalo, so I think so we can begin. So when I talk about the central nervous system, central nervous system के दो कौन से parts है, one is the brain and the other is the spinal cord, है ना? So ये दोनों major parts है that makes up our central nervous system. I hope this is very clear to us. When I talk about the brain, so obviously it is a main center that is responsible for processing information, impulses, and all. Spinal cord, it's a organ that is responsible for sensation and movement, है ना? That is why काफी लोगों का whenever there is a L4, L5 puncture, lumbar region, their movement, their posture is restricted, है ना? वो थोड़े से हम bend over चलते हैं. So that is why this is very important for movement and sensations. अब when I talk about CNS and ANS, so ANS तो हमने already finish कर लिया है, parasympathetic and sympathetic system. So what is the difference between them? The CNS is a more complex and it's having a greater circuitry complexity. ANS is comparatively simpler in because presynaptic, postsynaptic, synaptic bus. It's all about the impulse neurotransmitters release, uptake, reuptake, and storage. But CNS में there is synapses as well as neuronal impulses that are playing a role. So there are a lot of neurotransmitters also involved for CNS as compared to ANS. ANS mostly we have adrenaline and acetylcholine, right? But in CNS we have GABA, aspartate, glutamate, dopamine, acetylcholine, lots and lots of different neurotransmitters are in. Correct? So these are some of the major differences between CNS and ANS. When I talk about the drugs for CNS, mostly they will be targeting these particular diseases. And let me tell you, for multiple sclerosis, there is one approved drug. You should remember the name of that drug. It is nothing but fingolimod. Fingolimod. It is a very famous drug for multiple sclerosis. And we'll study about this, what is multiple sclerosis, what is amyotrophic lateral sclerosis, everything in detail. Right? But first, just we'll go through the basics. what is required, because GPAT में mostly इस पे question नहीं आते. They do not ask questions upon these diseases. सीधा drugs पे आते हैं या तो classification पे. But since you have enrolled in the course, so it's our responsibility that आपके base थोड़े से हम brush up कराएं. So we'll move through this part a bit quick and we'll move on to the main part जहाँ से questions pop up हो सकते हैं और mostly questions आते हैं, right? So when I talk about neurotransmission, there are 3 steps in neurotransmission. First is release of the neurotransmitters through the synaptic cleft. Suppose ये synaptic cleft है. अब यहाँ से neurotransmitter release हो. And then receptors है. यहाँ पे receptors है. So अब यहाँ से release होके वो इस receptor पे bind. That's the second step of binding of this released neurotransmitter on the receptors. And then finally ये receptor downstreaming signaling करेगा. Either G protein होगा तो cyclic AMP pathway होगा, CAMP, or it can be IP3 DAG, diacylglycerol, inositol triphosphate pathway, है ना? अलग अलग downstreaming signaling pathway होते हैं. Or if it is a tyrosine kinase receptors, it can be MAP kinase, it can be tyrosine kinase itself as a JAK, or there can be JAK-STAT pathway, है ना? अलग अलग downstreaming signaling mechanisms होते हैं. But वो mostly नहीं पूछते. So this is a 3 steps in which there is a basic neurotransmission. So you must know about this. If there is depolarization because of sodium and hyperpolarization because of potassium and calcium, sodium ka influx, calcium ka also there is influx, and potassium ka when I talk, it is efflux. Influx of sodium, calcium ka influx, and efflux of potassium. Okay, so these are the 3 major ions that play a role in the depolarization, repolarization, and hyperpolarization. In our anatomy 11th and 12th, we would have studied action potential essay. यहाँ पे depolarization, यहाँ पे late repolarization, यहाँ पे early repolarization, and then finally hyperpolarization beyond the threshold potential, below the threshold potential, right? So these are the different phases that you must know. I hope we are there. I hope everybody is understanding. Yes, Sabah, Saili, Monish, Israel, Heather, Daksh, are we there? Arunima? I hope we all are understanding. Now, when I talk about EPSC, excitatory post-synaptic potential, and IPSP, inhibitory post-synaptic potential. Okay, these are the 2 major potentials that are responsible for the transmission. EPSP, excitatory post-synaptic potential, and IPSP, inhibitory post-synaptic potentials. So the neurotransmitters of EPSP are glutamate and acetylcholine, while the neurotransmitters of inhibitory are GABA and glycine, right? So you must know about this very well. Now, when I talk about the mechanism, it is release of the neurotransmitters and binding to the receptor, which leads to depolarization, that is sodium influx. And this depolarization generates EPSP. Simple. Sodium influx, depolarization, EPSP. Clear, Chin? Is it clear to all of us? Similarly, on the other hand, potassium efflux and chloride influx leads to hyperpolarization. And this hyperpolarization further leads to IPSP, inhibitory post-synaptic potential. So ये चीज आपको मालूम होना is very, very important. That how EPSP, excitatory post-synaptic potential, is generated and how inhibitory post-synaptic potential is generated. है ना? So ions याद रखो and the process को याद रखो. Sodium ion, depolarization, excitation. Potassium ion and chloride ions, hyperpolarization and inhibitory post-synaptic potential. बस इतनी चीज if we remember, life will go easier for us, right? So you must know this 3, है ना? ये यहाँ पे लिखा हुआ है, but I hope that we make this flowchart. It will simplify things for us. Right? So when we combine this, जब हम साथ में combine करते हैं, तो action potential generate होती है. So when EPSP is greater than IPSP, action potential is elucidated. And when IPSP is greater than EPSP, yani ki there is more amount of potassium efflux and more amount of less amount of chloride influx. पोटेशियम ज्यादा बाहर जा रहा है और क्लोराइड ज्यादा अंदर आ रहा है ना. ज्यादा क्लोराइड अंदर आ रहा है, इनफ्लक्स. दिस मींस इनफ्लक्स एंड दिस मींस एफ्लक्स, है ना. अपर साइड एरो मींस एफ्लक्स, लोअर साइड मींस इनफ्लक्स. एंड इन दिस केस सोडियम आयंस का इनफ्लक्स ज्यादा है. Right? So you must know this. You must know this. And you know, in GPAT 2 years back, they even asked this question. Glycine is an example of which neurotransmitter? लो, थाली में परोस के तुम्हें क्वेश्चन दिया था that which neurotransmitter is involved in inhibition and excitation. So ग्लाइसिन क्या हम इतना याद नहीं रख सकते कि ग्लूटामेट, एस्टाइलकोलिन, डोपामीन. डोपामाइन में भी ना D1 एंड D5 ये है. ठीक है, D2, D2, D3 यहाँ. ठीक है, सो यू मस्ट नो डोपामाइन में भी सम pathways, not all. So this is very, very important for you to know. This is very important for you to know. Yes, clear till here? Are we clear till here? Any doubts? अब शुरू करते हैं. What are we going to start with? Parkinson's disease. Parkinson's disease में rat याद रखें. सर चूहे को याद रखें. अरे डियर, rat is rigidity, tremor and akinesia. Rigidity, rigid हो जाता है इंसान. The posture of the person is a bit rigid. Akinesia, muscular movement. उसके जो muscular movements है वो restricted हो जाते हैं. And T, tardive dyskinesia and tremors. तो tremors लगने लगते हैं, हाथ हिलने लगते हैं. Tremors, right? So rigidity, tremor and akinesia और bradykinesia, slower movement और abnormal movement. तो ये जो posture है ना, इसको हम बोलते हैं gait. GATE नहीं, GAIT, gait. Gait and posture वो थोड़ा सा एबनॉर्मल हो जाता है नॉर्मल ह्यूमन बीइंग से. दैट इज व्हाट मोस्ट ऑफ दीज ना आप लोगों ने देखा होगा, जो जेरियाट्रिक्स है, मोस्ट ऑफ द ओल्ड एज पेशेंट्स, दे सफर फ्रॉम सच पोस्चर एंड सच, बिकॉज उनका. अब ये मेजर क्यों होता है? बिकॉज ऑफ सबस्टेंशिया नाइग्रा पार्स कॉम्पैक्टा. ये जो रीजन है ये डिमिनिश हो जाता है. एंड the pathway involved is NS pathway, nigrostriatal pathway. This is asked in examination. Please लिखो ये pathway का नाम and the region. Substantia nigra pars compacta and nigrostriatal pathway. Nigrostriatal pathway. You must know about this. You must know about this. Yes, clear, Clear to all of you?